We are at the final part of finding the right therapist for you, and today we are talking treatment planning. So by now, you've already searched for therapists, you've reached out to them, you've done the free consultation slash the intake, you're feeling good about the therapist, and now you're ready for the first full 1 to 2 appointments. Congratulations. Be wary of any therapist that encourages you to start pouring into the details of your past or your traumas without an outline or even a vague idea of the goals that you have for therapy or the direction that you want to be moving into. Ideally, a therapist would at least go over your basic therapy goals and or go into full-on treatment planning before doing any serious work. Which way a therapist decides to go or the path a therapist decides to go on to discuss and to collaborate goals and treatment planning with you depends on a lot of factors, like the situation. Is this intense acute crisis counseling, or are you just coming in for private practice really chill? The location, is this like a natural disaster? There's a lot of things in place that could determine how a therapist begins this process, but at the end of the day, both you and the therapist should have a shared understanding of what your goals as the client are for therapy and what you consider to be the important parts of your treatment. A solid treatment plan is the compass for your work in therapy, and making sure that you get the most out of the therapy experience should be a collaboration between you and the therapist. The treatment plan should address the reasons why you decided to come to therapy, and it should give you a sense of what you're going to be doing in therapy for usually the next 6 months. If you, the client, are having a hard time describing your treatment plan in your own words, it might mean that the plan isn't clear enough and needs a little more work. Here are some reflection questions to help you determine if you want to continue to work with a therapist. How does this therapist match up with what you're looking for? How do you feel about the way this therapist makes you feel? And or how do you feel about the energy in the space when you are in session with this therapist? What do you think about the treatment plan so far? And how would you describe it in your own words? What kind of team do you think the two of you will be? Where do you think you'll be with this therapist in 6 months? All right, well, thank you so much. Have a great one.